What does this organization do?
So there are two things. As you know, there's an outcomes research department at the Cleveland Clinic, which is part of our Anesthesiology Institute, and then there is an outcomes research consortium, which is a very loose group of investigators all over the world whose only goal is to do research together. And the main thing that outcomes research does is to look at any possible perioperative interventions, and they not necessarily always have to be anesthesia only, and to show whether these interventions affect postoperative outcomes. So the interventions can be anything from giving extra oxygen, from trying out different fluid management, looking at regional anesthesia versus general anesthesia, looking at pain management, many things. And the outcomes are usually outcomes we believe that matter for patients. So it's things like postoperative pain, postoperative acute and chronic pain, postoperative wound infections, myocardial complications, postoperative cognitive dysfunctions. So I think the important thing is that we look at outcomes that historically were not necessarily always associated with anesthesia. Those can be surgical outcomes, internal medicine outcomes, but now we know that they all can be triggered in the perioperative phase. And many of these outcomes can happen either immediately, days, weeks, months, some even years after anesthesia. And outcomes research looks at all that, and so we actually try to establish some evidence for evidence-based medicine.